You're the guy people call when they need a helping hand, moving furniture, unloading a truck. But lately, your shoulder's been acting up, and you're the one who's calling for help. And that's the moment you realize you can no longer shoulder the load.
The Joint and Spine Center is Cincinnati's leading destination for orthopedic care with a range of surgical and non-surgical treatments. So when a moment has the power to change the rest of your life, go to the one place with the power to change it for the better, the Christ Hospital Health Network. This changes everything.
The Pound This Podcast is brought to you by the Christ Hospital Health Network. This is the Pound This Podcast, episode 748, Hand and Wrist Pain Plus Solutions with Dr. Noah Shaftel.
I want to lose weight, but I don't know how to get started.
What should I meal prep every week?
How do I get those sweet booty gains?
Inspiration for your healthy lifestyle. The Pound This Podcast with Amanda Valentine.
Thank you so much for listening to the Pound This Podcast. I am Amanda Valentine. My guest is Dr. Noah Shaftel from the Christ Hospital Health Network. How are you?
Good. Thanks for having me.
Yes, thanks so much for being here. So I got some questions for you from my listeners, and so I'm excited to get some answers. But before we get there, tell me all about you. What do you specialize in? What do you do at Christ Hospital, and how did you get there?
Yeah, so I'm an orthopedic surgeon at Christ Hospital who specializes in hand and upper extremity surgery. It's been sort of a long road to come back to Cincinnati, but originally grew up here and then moved away for a very long time for training, and eventually, when my wife and I were ready to start a family and get a real adult job, moved back into town about 9 years ago now.
Awesome. What part of town are you from?
Originally grew up in Montgomery.
Okay, cool. So where did you go to school? I mean, how long did it take you to go to school for all of this?
So I spent 4 years of college, and then 4 years of medical school, 5 years of residency, and then an additional year of fellowship.
Oh, awesome. So what made you decide that you wanted to work on hands, wrists, upper extremities?
I think a lot of it is sort of who you meet along the way, and sort of the mentors you have and things you like. One of the interesting things about what we call hand surgery, which has sort of always traditionally been sort of from the elbows to the fingertips, is we sort of do everything in that area. So that not only includes the orthopedic issues, but vascular issues and nerve issues. We do a little everything from microsurgery to fixing fractures to arthritis treatment to carpal tunnel syndrome and trigger fingers. So it really is a really broad spectrum of things we treat. So,
I mean, I would imagine with your job, it feels like that you're kind of like the top of the chain of somebody that has to work with their hands and wrists all the time. While you're repairing other people, are you doing damage to yourself by doing so much of that work?
Yeah, you know what? My wife doesn't particularly like when I'm working on the car or working with power tools at times because, in theory, I guess losing a digit isn't a great thing for a hand surgeon. But yeah, you know, it's like I said, we do everything from very, very small things under a microscope to big things, using drills and screws and plates and all sorts of stuff like that in surgery. So yeah, you know, keeping the hands limber and moving and working well is important.
Awesome. So some of the questions I got, a very popular question that was asked was best preventative exercises or stretches for someone whose job depends on their hands. What would your answer be for that?
Yeah, so I think if you look at people who really are what we consider high demand for their hands, I don't know, let's say someone working in construction or similar things. You know, a lot of it really starts not just in the hands, but, you know, it starts from the core and then extends, you know, through the shoulders to the upper arms, down to the forearms, into the hands. And just like any activity or sporting event or things like that, really the key is to start with a good solid core. So yes, core exercises, ab strengthening, and all of that actually helps stabilize the body so that you can use your hands and arms in an appropriate way. I think most people run into trouble is when they're lacking some stability or lacking some of that strength, and oftentimes they'll use their arms in ways they're not meant to be used. So it all sort of starts, like most activities, with core strength and then extending down the arms. As long as people are using things on a regular daily basis, we do get into bad habits about certain positions or certain ways we're carrying things that can get us into trouble. But most people get enough sort of daily use in their hands to keep them moving. It's really just avoiding the bad habits and the bad positions that really put us in trouble.
Yeah, I would imagine. I know, like, so many people that were asking this question are like hairstylists and working in their hands in that way. They were probably not expecting you to say, go work on your core as a solution to that. But
that's true. That's true.
But I mean, as a personal trainer myself, of like, yeah, everything comes from the core and it makes sense for me. But that, even to me, that's surprising to even think of, like, wow, when you're just working so much, or like even think typing or anything like that, of how that comes from kind of just strengthening where everything kind of begins from, and how that can turn into that. Like, that's pretty crazy advice. When you say that to people, what's the normal reaction to that?
Well, I mean, I think, I don't know, the phrase I've heard used to explain it would be, you can't shoot a cannon from a canoe. Meaning that if there's no stability, I'm sure you probably could, but
yeah. It'd be messy.
When I was in my fellowship up in New York City, one of the things they would always do is start examining somebody, and if they came in with a finger complaint or wrist complaint, and they'd say, okay, well, let's see, if you can reach your hands above your head, and can you get them behind your back? And can you get them to your mouth? And so all of it was, all of these things, if your shoulder motion isn't great or your elbow motion isn't great, then you really even can't get your hands in position to do what you need to do. So everything along that linkage has to be working in a reasonable fashion in order to actually get your hands where they need to be and use them how you want to use them. So, if you talk about typing, and so a lot of, focus has been on posture, right? So sitting up straight, and then getting your arms in a relaxed neutral position, and then finally getting down to the wrist position. So all of that stuff, it's a big chain, right, of different positions. And if the bases of that aren't stable, then using your hands becomes much more difficult. I don't know if that makes sense, but you just have to think about the hand as more of an extension of the body than it is its own isolated.
Yeah. No, that's awesome. So then, like, especially thinking of, going up the chain to a shoulder, because so many people have shoulder issues with typing, having that kind of rounded posture. So is there ever a case, I mean, I understand if something's going on in the shoulder, that's going to translate down to the wrist. Is there ever a situation where the problem starts in the wrist and then translates up to the shoulder and comes that way?
I think a lot of this probably just relate to sort of, I don't want to say bad habits isn't the right word, but I don't know. I think of it akin to, if you're lifting a box, you're supposed to lift with your legs and not with your back, right? And
yeah.
So that prevents you from hurting your back. And it's similar things. We do all sorts of stuff where we're carrying things at weird angles or at arm's length. There's things like that, yes, can stress both the hand and the wrist and the shoulder. And there's even something called a hand-shoulder syndrome, which is sort of an unusual phenomenon. But we don't think of them as intimately linked, but you certainly have different entities that can affect both.
So what about things like tendinitis? And I know this is just a random reference for me, that I had tendinitis when I was in high school and college from working at Subway and cutting the bread so many times in the same exact way. And then I would feel that there. So it's like, is the solution from that? I mean, there's nothing I could do to avoid that super repetitive motion. If I would have worked on core strengthening things, would that have done anything with this tendinitis?
Probably not so much in that instance, but like you mentioned, a lot of the repetitive things, there are a lot of things that get irritated or you get a tendinitis, and that's really just our body saying, hey, you've been doing too much of that. And just like cutting the bread, or if you think about people pitching or working on a factory line, any overly repetitive thing can certainly cause inflammation around the tendons or the joints. It can be something as mundane or even small, like let's say recently there's been a fair amount of people with problems knitting in the office recently, probably because it's winter time and they're knitting scarves and socks and things like that. But repetitive motions done to the extreme certainly can cause inflammation and functional problems with the extremity.
So what is the solution to that? To just take more breaks? Is there a way to stretch that out to kind of stop it from getting further along in the process of pain?
So, I think the first thing is certainly to pay attention to your body's signals. And when it's hurting, it's telling you, obviously, that something is up. I mean, that's a a response that our bodies have honed over, years and years and years. So number one is, backing off activities oftentimes helps. And even though sometimes it's a pain in the butt to take some time either away from work or from your activities at home or working out, sometimes that's what it takes. And then, yes, absolutely, strengthening things like anti-inflammatories like ibuprofen or Advil, ibuprofen or Aleve, things like that can be helpful. And then all the other sort of modalities we've come to learn, ice or heat, and then certainly some stretching exercises before and after can certainly help with all of that. Doesn't mean you won't necessarily get tendonitis, but those are certainly ways to help try to treat and prevent further discomfort.
So what are some of those like hand and wrist stretches?
Yeah, so, obviously most of us use our hands in a regularly normal fashion on a day-to-day basis. So we don't worry too much about that people aren't moving their fingers enough or things like that. But certainly, if you think about all the muscles that cross your wrist, there's lots of tendons that cross our wrist, and they provide what we call dynamic stabilization or motion for the wrist. So that's things like flexing and extending your wrist. That's things like flexing and extending your fingers. That's like what we call radial and ulnar deviation, which means if you're like waving back and forth from the outside of your wrist to the inside of your wrist, those are all things that are help encourage appropriate tendon gliding and tendon motion. That being said, just like warming up for a sporting event or things like that, warming up with your hands before you start working and you're cutting a bunch of bread, or before you start knitting for several hours, those are all things that can be helpful.
So you just just rub your hand, move it all around sort of thing?
You got it.
Again, ask a buddy, can you rub my hands for me?
That's right. Hand massage.
Yeah.
Yes, that always is helpful.
That's never awkward.
No.
So somebody did ask specifically, like, what causes tendonitis? Is it that kind of just repetitive motion? Is that pretty much the definition of tendonitis, or what does that all entail?
It usually is. One of the most common types of tendonitis we see in the hand or wrist is something called de Quervain's tendonitis, which was named after a physician who named it after himself. And
that was nice of him.
Yeah, that's right. That's very common, unfortunately. But for instance, we see a lot of that in new parents who are lifting up their child out of the crib, or if you think about how you lift a child, and that repetitive motion actually causes people to have some tendonitis, and it can be pretty uncomfortable too. But you think about repetitively picking up a child can cause it, or what's another good example? Well, that's the most common one for sure. But yes, the repetitive motions can cause tendonitis, and in those instances, the treatment is trying to avoid it. Things like anti-inflammatories and sometimes steroid injections, which are nothing more than just really potent anti-inflammatories. So it is sort of an overuse, your body saying, hey, I don't like this, please stop.
Gotcha. So that leads me into my next question, where many people asked that they had pain in their wrist when doing push-ups or planks or farmer's carries, and so what's going on with when they're feeling pain in that? Is that just getting into just a bad position and doing that over and over again?
So that's usually a super common complaint, believe it or not. And if people think about extending the wrist and pushing off like you're pushing up to get out of a chair, that position puts a lot of stress and strain across some of the small ligaments in the wrist. And we commonly see it with people complaining that they can't do weight-bearing positions with yoga. We see it with push-ups is very common. Specific weightlifting type activities. All of those things create a lot of stress and strain across those little ligaments in the wrist. And most of the time, the easiest way to get around those is if you think about, let's say, push-ups, doing them on your knuckles or on small barbells where your wrist is in a straight position. And same thing with yoga positions. Oftentimes, just something as simple as that is making sure your wrist is straight as opposed to extended all the way can do a lot in terms of helping that discomfort. But that is a super, super common complaint, and it doesn't necessarily mean that people have had an injury or that they're doing structural damage. It's just that the way the forces get distributed, the wrist is much happier when it's in a neutral or straight position, and that's the easiest way to work around those problems.
So how much, see, this is where my brain goes when you're thinking of like push-up, is just like, well, then are you bracing in your core? Like, are you kind of throwing all that weight onto your wrist instead of kind of coming from that core position and kind of distributing the weight a little bit more. Like that feels to me that could be something too.
Or your hand position, right? Or how wide your hands are spaced or how narrow they're spaced. So absolutely. Absolutely.
So what are your thoughts on like wearing like braces or like just like those sleeves and stuff like that?
Yeah, I think sometimes people derive some benefit out of it. I mean, if you look at, I don't know, taping, right, which we see on ankles a lot, but some people do it for the wrist. Most of the studies looking at those show that really after a few minutes to 10 minutes, they're really not doing much, right? Tape stretches out. It's not really providing much support. Same thing, a sleeve is probably a little bit more durable in terms of providing some support. Do we know that it's providing a lot of stability? Probably not. Probably some of it is psychological, but there is some warmth and compression that goes with it too. And for the most part, I think people can be, feel free to exercise and do their activities without those things. They don't necessarily protect you from having an injury. But if people feel more secure or they feel like they're more comfortable with them, they're absolutely fine. But I don't think they're absolutely necessary in terms of trying to prevent injury.
Okay. And so I did have several questions about how to get carpal tunnel relief. And I guess I want to start before we get there of kind of like with tendinitis, like an explanation of like what is that and then how do we get that and then how do we find relief?
Yeah, so carpal tunnel syndrome is very common, probably the most common thing we as hand surgeons see in the office. And even after all the research that's been done into it, we still don't have a great sense of why people get it. Lots of things have been blamed over the years, and lots of things have been initially blamed and then debunked. But we still don't have a great sense of why necessarily certain people get it. And all it is purely it's compression of one of the nerves that goes through your wrist into your fingers, and it provides sensation to your thumb and your index and your middle and half of your ring finger. And it's commonly people get numbness and tingling in those digits, or they have pain, particularly at night. They wake up and feel like their hand's asleep, and they got to shake it out, throw it over the side of the bed. And so it's very common, and I think for most of us, we sort of understood that, oh, hey, it's related to computer work, let's say, or something like that, and that's largely been debunked. That computer work or typing doesn't cause it. It just the computer happened to be blamed for it around that time.
Gotcha.
So, but we don't know why people get it. It's probably a little genetics, probably a little activity, probably a little luck. We do know there are certain endocrine problems that can cause it, like thyroid issues or diabetes can sometimes contribute to it. Or it's very common in pregnancy when women have redistribution of body fluids, and some of it gets distributed into the carpal tunnel. So there are certainly things that can cause it, but for the vast majority of folks, we don't really have a great sense of why people get it. So
is the relief kind of the same as some of those anti-inflammatory pain relievers? And then I guess at what point do you, if that's the first step of pain relief, then where do we get to from there to surgery?
Yeah, so usually nighttime symptoms are usually the first time that people experience them. So when it wakes you up from sleep at night and you feel like your hand's asleep, people say, oh, I was laying on my hand. But oftentimes it's not laying on their hand. It's just we all tend to sleep with our wrist in a very flexed position. And that puts lots of pressure on the nerve. And you can imagine it's like sitting on your leg for too long. If your wrist is flexed for too long, then it feels like your hand's fallen asleep. So the first step, usually if people have nighttime symptoms, is just have them wear a wrist brace at night that just keeps their wrist straight. So similar to what we were talking about with push-ups, just keeping your wrist straight oftentimes is enough to take away the symptoms and let things calm down, and then people can move on with their life. But there are some people who that doesn't do the trick, and they need more than that. And there's really only a couple other things that have been shown to make a big difference, one of which is carpal tunnel injections, and those are steroid injections, which can be helpful in alleviating symptoms. A large percentage of those are temporary, and people do end up coming back with symptoms again, but that's one way of alleviating them. Oral anti-inflammatories can help to some degree as well. And then a carpal tunnel release, which is the surgery for it, is where we actually open up the carpal tunnel and take the pressure off of the nerve. And that's obviously the most invasive, but obviously the most definitive treatment for it as well. And works pretty darn well in terms of helping those people who a brace or an injection haven't helped. So, the important thing is people recognizing that symptoms aren't being relieved with a night brace, or that things are getting worse, or they're becoming more frequent, or they're more obtrusive. Those are all signs that the nerve is being compressed, and is your body's asking for help with it.
So how often do you see when a patient comes in and is having these issues and you're kind of walking through the beginning stages of it, how often does that usually lead to surgery?
So carpal tunnel syndrome, generally speaking, is a progressive problem. There are some people who it can go away for a while, but oftentimes will come back. And oftentimes, people end up at the doctor because it's really bothersome to them. So we don't necessarily see people in the very early stages. Most of the time they say, I've been having symptoms for a month or a few months or a few years. So by the time they get to us, most people have had symptoms for a while. And so a significant proportion of them do end up going on to needing surgery. But the people who can be managed without it, if it was my wrist and I could manage without surgery, and my symptoms went away, I'd be totally on board with that. So it is a fair amount that end up needing surgery, but not everybody.
Okay. And then I wanted to go back to kind of like the chain of command that we talked about, of like the wrist to the shoulders to everything else. So, as a person who's as a personal trainer, and I guess, my scope of practice is very limited compared to yours, obviously, but it's usually if somebody is feeling pain, like it's like that is not our job. We need to send you to a physical therapist, to a doctor, etc. But would you say that, say there's just general nothing like that to that level, would it make sense if somebody's kind of like, oh, I just have achiness in my wrist or having issues, to start working on like shoulder mobility? Like, is that where, if somebody maybe, or like, for me in my job, or somebody listening to this that is trying to like exercise more and noticing that, is that kind of where they go, and how, and will that start to alleviate some of those issues?
I certainly think in certain situations it can, and I don't know, I think sort of the model for that being, let's say, a baseball pitcher. And we know that lots of pitchers have trouble with their elbows over time, especially people who pitch a lot. We see a fair amount of adolescents with problems pitching or pain with pitching. And when it actually comes down to it, if you have them evaluated for proper pitching technique, a lot of them are lacking the core strength or the core stability or the shoulder stability or the shoulder blade stability. And so they have poor technique, which then puts stress on the elbow and then gives them pain. So there are certainly instances where other parts of that kinetic chain are not working correctly and need to be addressed before anything can be improved with the elbow. And so a lot of things, it's a technique thing. I mean, you can see, even when we see professional musicians, let's say, who have some tendonitis or other issues in their hand, oftentimes they've sort of strayed from good technique and sometimes need a little refresher with one of their mentors regarding appropriate technique. So I think it's important to always think further upstream. And there are some people that despite that, if they continue to be symptomatic, then that's the time to go see a doctor. But, a little anti-inflammatory here or there, working on some strengthening exercises and stretches. And if all those things continue to be bothersome, then certainly consulting with a physician is a reasonable option.
So do you have any like best advice before anybody comes to any of these issues or has any sort of pain, of like just basically what's some good rules for general like wrist and hand health?
In terms of?
Like, is there anything that we can do? Like, is there any sort of just like mobility drills that we can just sit at our desk and do? Does anything like is there any way to like prevent any of this happen? Or it's just going to be like, you know what I mean? Of like, oh, well, if I move my body, then it's less risk that I could possibly like have pain. Is there anything, or is it's just going to happen if you're doing repetitive motions, or if you're pinching things, or is there anything, I guess the boils down to, is there anything preventative you can do?
Yeah. So, obviously, I always tell people, for instance, taking frequent breaks, and it's something where we could be typing on a computer, we don't think about it, an hour goes by, 2 hours goes by, people are working at home, 3 hours goes by.
Yeah.
And people forget that, you need to take a break, 10 or 15 minutes every hour. Those are certainly things that can help prevent issues like that. And it's similar to any other, any other activity that it's fine to push your body to a point, but just like we all need to sleep at night to get rest, our hands and wrists need it too. So taking frequent breaks, and just making sure, like you were mentioning, that you're not having significant discomfort is usually the best way to avoid anything. And if things start bothering you, start having cramping in your hands or numbness and tingling, then obviously backing off those inciting activities can help. The other thing we think about is if you're talking about things like a weightlifting regimen, is going slow. So to say I'm going to go from not typing at all to being typing 8 hours a day at my job, well, of course, your body's going to not be happy with that. So weaning into things slowly and building up slowly is always helpful as well.
Okay, great. So what's kind of the chain for you of like if somebody is listening and they're feeling some sort of pain and they're looking for some solutions, do they go to their primary care doctor and then they refer them to you, or can somebody just like come straight to you? How does that work?
Yeah, I mean, I think there are a lot of people certainly who have rapport with their primary care doctor, and that's certainly a reasonable place to start for a lot of basic musculoskeletal issues. And usually they're we'll try the basic things like bracing or anti-inflammatories or rest and things like that. And oftentimes if that doesn't work, then they end up referring them on to a specialist. But I certainly see people who come in without seeing their primary care doctor first, and that's fine as well. And most people, by the time they come in, have tried some basic stuff. They say, well, my wrist is bothering me, so I picked up a wrist brace at Walgreens, and I've tried wearing it and it's not helping. Or I've tried taking some ibuprofen and it's not helping. Then, yes, those are all appropriate. And anytime, certainly, you're talking about numbness and tingling, we were talking about carpal tunnel syndrome. So numbness and tingling, nerve-type symptoms would be a reason to see the doctor. And even there are plenty of people who just come in because they're concerned about, am I doing damage? Is something wrong here? And that's a totally reasonable or totally appropriate reason to see the doctor too.
Okay, great. Well, if anybody has any further questions or are looking for some advice, they can always shoot an email to marketing@thechristhospital.com, and the team there will get some answers. And is there any other way to reach out to you other than thechristhospital.com?
We can be reached certainly through our office, which is all of our website. Go through Christ Hospital, and email certainly is an easy way to reach out to us as well. And things if people check their, most things have gone electronic these days. So My Chart, which is a feature through our electronic medical record, allows patients to reach out to us through an email form, basically. And most physicians are on that type of platform these days, but it makes it really easy for patients to ask quick questions or address concerns that way as well.
Okay, awesome. Well, Dr. Noah Shaftel, thank you so much. That was extremely informative and very helpful, and I really appreciate your time.
Thanks for having me.
AmandaValentineBites.com